I feel like Mrs. Thatcher there.
Ladies and gentlemen, thank you very much. Obviously also very pleased to be part of this panel and obviously also being in the same position. Basically all the points have been made, or most of them at least, which, in its own right goes to show how far we've come in the advocacy, and which I think, which other panelists have also mentioned, it's building on the engagement, the activism of, well, decades of people taking the issue forward, and we've really arrived at a stage where it's high on the agenda. At the same time, we've heard, given the progress that we're making on reducing prevalence rates, there's so much to be done. Given the focus of this panel looking at, on the one hand on building bridges and on the other hand looking at the role of media in that, I'd like to pick up on this notion of utilizing social norms to stimulate positive change, with the notion that we have communities abandoning FGM based on a change in perception. And when you have the term zero tolerance, that has to be the zero tolerance from the society within. And I think we have to be careful that in the activism, in the advocacy, we don't create this us versus them, because it creates alienation. And when we look at building bridges then between migrant communities in industrialized countries, specifically in Europe, and we look at the current debate also about integration of migrant communities, also with a view to in the integration or the religious dimension of it, let me put it this way. We really need to be careful not to alienate and create a sense of exclusion. And I suppose the pressures within migrant communities in relation to marriageability of children demonstrates that this is probably communities that look for marrying within the communities themselves, as an example. So this is also about keeping to the community itself. And as Jane mentioned, there is a sense that at times migrant communities become almost more conservative or more attached to traditional values when moving abroad. So that's clearly a dimension that we need to address. The other one that was already also mentioned is connecting communities in countries of origin and in the diaspora. And I'd like to bring out one aspect in there, from UNICEF's perspective. Engaging young people in this debate. And we heard the social media aspect. We have increasingly connection between young people in the global south, young people in the global north. And I think we need to take the debate forward under that aspect, using the opportunities that this increased connection brings up. But at the same time, make sure that it is really sort of built on human rights, built on children's rights, and has a sense of empowerment of young people in that. The third then is when I hear the very encouraging efforts also that come from governments in Europe, where there's increased attention. We heard entirely from Norway and from the Netherlands, which is quite encouraging. At the same time, I think there's also a need to connect these efforts, probably more than we do so far, to understand better what has worked. And already, again, also that was mentioned, that we need sort of a solid knowledge base. This, for me, in particular, with a view to behavior change communication also. It's not about just printing T-shirts or slogans, or there's a lot more to it, and we need to make sure that we're not reinventing the wheels across countries there, but share those good practices as we move forward. Overall, I share the to a degree, or I guess we all share a sense of frustration about the limited progress that we see. On the other hand, I think the top-down approach, the social change approach, is something that we're only just scaling up now. So, and the joint UNFPA-UNICEF initiative sees progress. I mean, we have reduction in the prevalence rates, and so it's also important that we sustain that momentum. But then at the same time realize that we are in this for like a generation. So this is in the long haul, and that this needs sustained commitment. And in that context, obviously, we're very appreciative of the donor commitment that again has been reiterated here today by a number of the mission representatives. So with that, probably I'd like to conclude as a recommendation from UNICEF's side that we, that we really ensure that we work with young people, boys and girls, that we do that by also connecting the diaspora with the sort of children in countries of origin, and at the same time that we have really a strong child rights approach in this, so to embed this in a good understanding of why do we need or why do we have non-discrimination as a key principle, and why do we need the empowerment of girls and women. Thank you.
Thank you very much for those very interesting points and for summarizing it in one key point for us. I would quickly go on then to the next speaker, and that will be Elise Johansson.
Thank you for being here, and it's really great to be part of this widening world of different type of partners are working more and more against female genital mutilation. The issue that I really wanted to highlight is the issue with WHO has worked a lot with the last year is the issue of medicalization. As we know that now more than 18% of all girls and women who have undergone FGM has done so at the hands of healthcare provider. There is big variations between the countries, from 1% in some countries to between 9 and 75 in 6 countries. And I think it's a very strange that all the UN agencies and professional organizations within medicine as well has been part of this global strategy against medicalization of FGM. And we think that to engage health professionals to support the abandonment of FGM and never to perform it is critical to the success in eliminating the practice. We know that we know that even last year there has were suggestions from some medical associations to start to perform some sort of mild symbolic FGM, and they withdrew. There was an American Pediatric Association withdrew their suggestions, but it comes up all the time, and we hear it rumors from many countries in Europe that this is a good idea and that people are promoting it. So we see that the issue of FGM is also moving towards Europe in that sense. And many people think also when we present on medicalization of FGM, even many people who are against and work hard against FGM sometimes think, oh, but it's medicalization is a good idea. It might reduce some of the immediate risks, health risks, and it might be a step towards abandonment, and we can get some control. And there is no evidence to suggest that medicalization is doing any good. And people then ask why healthcare providers do this. And of course, one reason is that they are in the countries, they are a part of the culture which supports this practice. It's part of their culture and social surrounding, and there have been studies, for example, among medical doctors, where more than 50% think that FGM is a good idea and even necessary and even beneficial for health. So it's really important to work against this issue. Another issue, which is what sort of has motivated, I think, also the European or Western, we know that the deep-rooted reasons behind FGM are not satisfied through a ritual nick. I can't go to the details, but the key is that in countries they remove the clitoris to reduce women's sexual desire. They close the vagina to prove virginity. None of these purposes are satisfied with the ritual nick. So there is no reason to believe that this will satisfy anything. And also, if another reason is they think that if healthcare providers don't do it, then the family will go to a backstreet performer. But if the parents are sort of willing to do something symbolic which doesn't harm the girl, I think they are more likely to be willing to give it up altogether than to do a serious, dangerous, risky procedure at the back door. So I think that it falls on its own argument. So on the contrary, if healthcare providers agree to perform female genital mutilation in any form, they contribute to legitimizing the practice, they can contribute to spreading the practice, or they can give the message that this is harmless or even healthy. And I think, especially in these days where actually circumcision of men are promoted as a preventer of HIV, and we have heard rumors that some communities start to think that maybe FGM is also would prevent HIV prevention. I think it's very, very important that we get the messages clear and that we include this in all activities. And finally, if doctors in diaspora countries agree to perform even symbolic forms of FGM, this will be spread in the media, it's spread all over. And what signals does this send to the countries back home? We know, for example, Egypt had for some laws that you could only perform FGM when it was medically necessary, and it was no reduction in the prevalence. So people interpret this according to what suits their beliefs. So the signal effect and this flies very fast with the media. So I think I'll stop here. This is key concern.
Thanks.
No, one more. I just wanted to encourage people, maybe it's a discussion, but we say there is little prevalence, and well, I've looked at the numbers recently, and we looked at the numbers from the DHS and the mix, and we looked at the difference between the older generation and younger generation. We found that there are 8 countries where the prevalence is more than 50% less in the lower generation. So there is really comforting. Then we have 8 countries where there's almost no change at all or even increase, so we have a lot of work to do, but we shouldn't give up hope.
Thanks, Alice, and it's not because you're from the WHO that you got the extra seconds. I think I quickly go on then to IOM across the road from us, to Ms. Mollard, who's representing IOM.
Thank you very much. It's a real pleasure for me to be here today and to see so many experts and policymakers discussing such a strategic aspect of the promotion of abandonment of FGM, for which IOM has been an early advocate, which is the creation of synergies between continents. I'm also very happy to see discussions like this as an opportunity for European countries to be able to discuss with African countries and maybe to try to learn from the experience of African countries in which the efforts to counteract FGM has been a priority for several decades. I'll be very brief because we do allow time for discussion, but I just want to make a few points, especially to say a few things about what makes FGM in migrant communities so specific and what can be the reasons to build a case for the involvement of diaspora groups in all sensitization activities. So first of all, I just want to specify, as it was said before, that we deal with female genital mutilation in the broader framework of gender-based violence, and we consider this issue as a human rights issue, of course, a reproductive health issue, but also a very strong integration concern. In particular, we consider that the physical and psychological consequences of the practice on women and girls who relocate to a new society can deprive them of their health, of course, and the energy they would need to adapt to a new society and to become a full member of this new society. But it also conflicts, the practice of FGM also conflicts with the fundamental values of most of the host countries. Building on, so I just want to mention that IOM has first become aware and concerned of the practice of FGM when working with population to be resettled to industrialized countries such as Europe and Northern America. And later on we have worked on other projects more closer to integration. And in all those projects we have tried to keep in mind an important element that was mentioned by my colleagues from UNICEF and UNHCR. It is that moving to another country can be very challenging, and for families who try to adjust to a completely different environment, and while trying to preserve some elements they consider key for their identity and their culture, it is very frequent that we observe this kind of withdrawal into the community and a stricter application of some cultural practices, either positive or harmful. And FGM or early marriages or honor killings are among those aspects. So we see often a very stricter application of those practices because of migration. So that makes the promotion of abandonment of FGM in migrant communities especially challenging and difficult, because awareness activities can be easily perceived as judgmental and stigmatizing the migrant communities. But also, it was mentioned with the role of the media, it can also contribute in stigmatizing migrant communities from the eyes of the host society, which is something we really want to avoid. Regarding the reasons to make sure that diaspora groups are involved in awareness-raising activities, I want to mention a couple of examples taken from our discussion with the several programs going on in Africa, especially programs building consensus towards the abandonment. They have realized that diaspora groups often, because they are not the target of sensitization activities, they can lose touch, they can lose the impression of what is going on in their country of origin. Even though progress has been made towards abandonment, they can cling on the continuity of the practice when they live abroad, and sometimes they can even jeopardize some of the progress happening in the countries of origin when they come back for visits or upon return after migration. So it's absolutely key to make sure that diaspora groups, because they are influential regarding the country of origin, that they are involved in any activity, any consensus built toward the abandonment of the practice. So that's a very key point I wanted to make, and also to acknowledge the role that diaspora activities also play in promoting the abandonment of FGM, and we have a very good example here with Mrs. Hard's work. It's important to acknowledge their significant positive influence on social practice. So lastly, I want to conclude on reinforcing the point that most of the elements that we've seen very effective in promoting abandonment in Africa should be also adopted towards activities in Europe to implement the strongest consistency of approaches. And among those elements are, of course, it was mentioned before, empowering the communities, building consensus around the transformation of social norms, and referring to human rights principles. Thank you very much for your attention.